Are you on mute? Oh, gosh.
I'm on unmute now.
Great. Okay, fantastic.
Can you hear me?
Yes.
Can you hear me? And can
yes,
you
we can hear you. Can you not hear me?
Yay!
Yeah.
Hello from the jungles of Mexico.
Everybody wave, come on.
It's so nice to be there. I feel so happy and lucky. That's
So-
Boaz, Paul, I see people. I see Doug, I see Juliana. Oh, it's so exciting. Thank you.
So,
Thanks for showing
very
me.
excited to
Yeah,
introduce you,
wow.
Claire.
Wonderful.
Claire is...
Yeah, is the lighting okay?
Yeah,
Can you see
you're
me
looking
just before
beautiful.
you introduce me? No, I just wanted to make sure because I looked like an Oompa Loompa.
You look
the
great,
lighting
you look
kind of
great.
Purple. Okay.
So Claire is a very dear absent friend. She was hoping to make it here, but she burnt herself out doing treatments in Australia. But she is an absolute pillar of the Ibogaine community, if you don't know her already. And she's loved by many people, and she's now recuperating in Mexico. So I'll just do the formal intro. Clare Wilkins is a former intravenous drug user and methadone patient who, in 2005, shared her chemical dependencies with Ibogaine. At Pangea Biomedics, she has facilitated over 600 treatments and worked together with MAPS to study the long-term effects of Ibogaine on patients undergoing detox. Since 2010, she's been a board member of GITA and has presented at numerous conferences. Currently, she's collaborating with Dr. Raul Morales to develop a clinical trial for opiate detox with Ibogaine at the University of Guadalajara in Jalisco, Mexico. As a member of Input and Inwood international drug use rights organizations, she's devoted to reducing stigma and harm, promoting the health and defending the rights of people who use drugs. Claire is committed to providing safe, loving, and compassionate care for extremely physically challenged people and passionately believes in every human's basic rights to medicine. So Claire is going to be talking about Iboga, cannabis, ethics, and alliance. Maybe just talk for about 15, 20 minutes, Claire, and then we'll have a few minutes of questions.
Yeah, we've got like half an hour is total, right?
Yeah.
Okay. So yeah, I know it's a mouthful and it's not that, jazzy of a title, but it's what I'm talking about. Right now, there's a lot going on in Mexico, and quite a few people have been asking me, excuse the sweat. I'm in a tropical area, and I'm sweating and always nervous when I talk, as you know. So there's a lot that's been going on in Mexico, and there are a lot of questions about what's happening in Mexico. Am I being heard? I'm getting an echo. Okay, I'll just deal with the echo. So as we know, Iboga is an alkaloid that grows mostly in Gabon. And cannabis is also used and grown along with the plant, the root. I'm going to talk about a series of cannabis users and advocates and researchers first, and how it's connected to Ibogaine, Iboga. Is there a way I can mute you or mute myself? Yeah, that's way easier. Thank you. And then I can do my talk. And if you want to mute yourself back in to pause and say anything to me, let me know. That'd be great. My brain is way better. Okay, so there was the Yippie movement with Abby Hoffman and Dana Beal, Howard Lutzoff and drug user rights. With the statement, we have the right to use, we have the right not to use, and we have the right to choose. And not for us, without us. These are key statements in the drug user movement that has existed for decades and decades. And Howard was a bridge between the Iboga movement and the harm reduction movement. And part of the talk is involved under the umbrella. The talk is involved under the umbrella of harm reduction, using cannabis as part of it, and also how cannabis has affected the opioid crisis. So going into harm reduction, and Howard was, for Ibogaine, he was also a board member of the National Association of Methadone Advocacy, and Input. So he was a balance, and not just exclusively into that traditional abstinence model, and was a mentor of mine, is a mentor of mine. And his words and his writings and his I never get tired of his work that he's done and the questions that he asked. And so with marijuana, cannabis, when I first came into the Ibogaine movement, I'd heard about some clinics that used cannabis, mostly in pot brownies, actually. That's what I had heard. And when I purchased the Ibogaine Association from Martin Palenko, we were the only clinic in Tijuana, and we created Pangea Biomedics with a staff of 12 in a villa, which was essentially a quasi-hospital in a lovely Zen home. And we followed the medical model and catheterized people. And there's several people there who have been there, and Kingsley and Christine, numerous people, Dr. Miguel Angel, who saw what we did and how we worked there. And it was, how do people sleep? And it was mainly benzodiazepines and even antipsychotic meds and psychiatric meds. And Howard even, I remember recommending, just give them Seconal, they'll at least get a few hours. And it just never felt right, you know? And post-flood, people couldn't, a lot of people didn't even respond to, everything's okay with my sound? Okay, post-flood, you know, when you do a flood, many people are up for days, and it can create its own kind of psychosis or super awareness that can harm as well. So we looked into that, and some of my mentors, well, one is right there, that beautiful man Boaz there who handed joints out. Is joints a slang in Europe, or what's the word? Marijuana cigarettes at the Gaza Strip. I mean, what a brave soldier for love there. And Valerie Corral is one of my mentors, and she was one of the first, created the first dispensary in California that's been around for decades, and is a nonprofit that created the cannabis oil that's used, and the lager oil that's used to treat epilepsy and cancer. And she's created amazing protocols using cannabis oil. And so these are my mentors and heroes. And Philippe Lucas, who wrote a paper when he was working with the University of Victoria and the University of BC in Vancouver, in Canada, and wrote a paper and did a study on 400 patients who chose, 87% of them chose cannabis over pharmaceutical meds. And he created the line that cannabis was not a gateway drug, but it was an exit drug. And I started researching, and while we were working and learning and reading about chronic pain, like, how do we deal with chronic pain? What do you deal? And I would call other clinics, and what do you deal with people who've had 25 surgeries? What do you tell them to do? Just stay off opiates, buena suerte. And, you know, with the harm reduction movement and meeting people where they are, and some people just want to be on 30 to 60 milligrams of morphine and reduce their tolerance and treat their pain still with opiates. And we're finding that in Mexico, cannabis is treated as a narcotic. You can actually intern a family member for 30 days if you think they're overused cannabis. And when we were first in Tijuana, it was very taboo to discuss it. And it was when dispensaries were first popping up in San Diego. And so the cannabis oil protocols, and now in Mexico, it's begun to be legal since the Supreme Court case. And we're going to see, as an adjunct therapy, CBD, THC, and Phoenix tears therapy for chronic pain management, because this is what we see with clients and with other, this is a grassroots movement, just like Iboga is. It's a user-driven movement. We have people moving to Colorado to treat their children with epilepsy and get the cannabis oil, and it's not coming from the doctors. You know, it's coming from the users and the people who are sick and who are willing to break the law even to get well. So it's very analogous to Iboga and intertwined, and a great deal of the Iboga movement has been funded actually by the cannabis movement. So we can look forward to using cannabis to get off of psych meds, and using cannabis as an adjunct in Iboga therapy to, when we did the Iboga Safety Forum in the Psychedelic Science Conference in Oakland, we asked everyone who was there, what do you do when you tell people to come off antidepressants before Iboga, or to come off antipsychotics or Seroquel? Most people don't have, most providers and clinicians don't have protocols. It was crickets were chirping when that theme came up. And cannabis oil is an incredible tool for coming off of a lot of medications and covers a lot of bases in terms of opiates and benzodiazepines. So I wanted to make that point strongly. Now that legalization has occurred, what has happened is, I don't know if anybody there is familiar with the work of Don Winslow. He is a writer that's been studying the cartels and the Mexico narco trafficking for, I don't know, 20 years or so. And there was peace in various areas of Mexico for a while. I was actually in Tijuana at the height of the war between Sinaloa and Tijuana. And, you know, this is a touchy subject, cartels, narco trafficking. It's not easy for me to talk about. And but this is the reality. We're in a country where there's a drug war going on. And we're nearing, I think, 200,000 people dead since this started. And it's about, they say about 25,000 or more per year are dying, you know. And so legalization created a 40% reduction in profit for El Chapo, for the main cartel here, Sinaloa, which controlled the vein up into the United States of cannabis. And so 40% is major. These are businessmen. These are people with money, billions and what you can't, money I can't even imagine. And according to Don Winslow, and I've done some research and just in living here and seeing what's happened with the fentanyl and researching, what they did was, their idea that they came up with was putting fentanyl into the heroin. And not only that, they're stamping it into Xanax. It's going into 80s. They're called shady 80s. Fentanyl is everywhere now, and it's a huge profit margin. So we have this opioid crisis that everyone's talking about now, that even Trump is mentioning. And is Ibogaine the solution? And my answer is no. We're not ready. We're not ready for it. Ibogaine is growing exponentially. Opiate use is growing exponentially. And the vast majority of people who are calling people for treatment, calling clinics, calling providers, going to the underground, are completely confused. I've been a board member, an active board member of GITA for many years, and Doug Green, who's sitting right there, is the head of the patient grievance committee, and the number of grievances that we receive, a number of questions that are asked, show us the mystery, this giant mystery that exists regarding Ibogaine for people and for treating chronic conditions. And there's a lot of confusion. And so it feels like that with these clinics growing exponentially, there was one clinic in Tijuana in 2010, which was Pangea, our clinic, and now there are about 17. And they're growing exponentially. There's no regulation. These invasions that people have heard about, where people have been extorted, federal police have come in, some people haven't been paying their tax, some people aren't registered as businesses. There are various reasons for all of this, but Ibogaine is very much on the radar at the border. It's attracted a lot of attention, and it's grown. And clients are called customers or leads. It's treated as business. There's a lot of competition. And this is where I want to talk about slow is smooth and smooth is fast. Ibogaine just cannot handle this demand right now. What we need is unification. And this is where I bring in the ethics and community and best practices and alliance. The Bwiti Boga for Ancestor Connection. And Bruce Alexander, who wrote The Globalization of Addiction, which is one of the top 5 books on addiction right now and for years, talks about social dislocation. And his theory is that people use a narcotic and heavy narcotic like morphine or cocaine because they're isolated and they're dislocated, and because of the competitive free market. And what started to happen in Tijuana was exactly that, actually, was the style of business was of competition, division, individualization. We had Pangea, as several of you there know, Christine, Dr. Christine, she's a doctor now. We welcomed people in, and we were very open and not insular. Ken Alper taught me right from the beginning about transparency and about being honest, about adverse events, about learning, so that other people didn't have to go through difficult things that we went through, even with a 24-hour, 4-doctor team staff, 12-team staff. So the community started and wanted to form in Tijuana, but it didn't. It's like you bring out your transactional analysis book and you become mommy and I become the ex-wife, and a whole bunch of inner fighting and competition started occurring, which still exists, and it exists on social media. And I moved, I left. As soon as people started coming in and doing this style of work with Ibogaine, and moved down to San Francisco Nayarit, which is where I am now. It's chickens and roosters and dogs and jungle. And Rocky Caravelli and Asha Caravelli were here from Awakening the Dream. They had their institution here for the last 9-10 years, and now have left for another location. And Christopher Lawrence and Mira had Iboga Root Garden House here, and it became a community, and it was a different kind of community that was non-competitive. And people stayed on to live, and it became a rat park that Bruce Alexander talked about. And I've mentioned this in a previous talk. So this became sort of land of the lotus eaters, where like a port of people coming for treatment, for dependency, and then staying on and finding their ancestors, finding their tribe, finding their family. And it was really beautiful. And these hubs started to happen across the planet, in South Africa, in Costa Rica. And so what is going on with Mexico clinics, and why can't we have these rat parks where we're all choosing to hang around and sleep and play and learn from each other, instead of hit the morphine button or hit someone or say something that sounds like a hurt? How can we deal with this division and competition and pecuniary interest and lack of interest in research and this hype and this evangelical hype about Iboga? And what I say is, it's not the government that's against us. It's not the pharmaceutical industry that is against us and our movement. It's us that is against us. And I say this from my I say this from my own personal experience. And it's really intense to be in the middle and be in the center of not only a civil war, but of a movement that so much wants, like the Underground Railroad, like needle exchange, that were laws that became outdated. So much, we all so much want this to be something that continues to be safe, that can grow and that isn't tapped, that is here in nature. And so what's the solution? The alliance. Solution is collaborations, ethical practices. ICEERS started a psychedelic Hippocratic Oath in 2014 and passed it all around, and it kind of faded because there's so much inner fighting or people with differing opinions, and it's hard to have cohesion, and especially about ethics and psychedelics and these deep issues. So the solution is sharing, open source protocols, being of support, regulation. There's a lot more regulation happening. Canada just regulated Ibogaine. South Africa just did, and it looks like Mexico probably will follow. So the solution is research. Get it into data. Get it in the language that the scientists go, oh, okay, yeah. Networking, outside advisors, tracing back to the roots in Africa, and returning this favor, this giant favor that people call miracles. Investing in this climate. Look at this map right now. Look at our planet right now. Acknowledging the higher laws and the source of our freedom. Howard referred to the perverted laws, the outdated laws that resulted in the Underground Railroad, and corresponded that to Ibogaine. And we're dealing with that. And we're dealing with really brave people, the clients / patients, the providers, the clinicians, embodying what we want to imbue to others. And meanwhile, there's a shrub somewhere around Donald Trump, a star jasmine with Ibogaine in it, somewhere around him somewhere, right under his nose. Ibogaine is here. And it's for us to come together and share all these wonderful things that I've been getting messages about, and that we've learned here, and that everyone has learned, and come together, unified as an organism that we are. So I'm finishing with this little quote: do unto others 25% better than you expect them to do unto you, to correct for subjective error. And that's Linus Pauling. Thanks.
Okay, anyone got any questions for Claire?
How many minutes did I take up?
You're okay.
Okay.
Any questions? No questions.
Wow, no questions.
We have a question. Alvaro. Yeah, you come here.
Alvaro? Is
Hey,
it
Claire,
Alvaro?
we meet here.
We meet we meet digitally.
I do have a question, and it was about lack of sharing information. And what particularly worries me with outfits that provide Iboga or Ibogaine treatments is that we're losing data. We're actually not receiving or collecting data from all these treatments. Now, even though it might be anecdotal, we need to find a way to group everyone together to collect this valuable
I just have
data.
to interrupt you right now. And ICEERS has been trying to collect data from patients for years now. You know, this is a process that has started for a long time, and MAPS has been doing that as well. So what is the question, actually? Sorry to interrupt.
Well, it was more about how we can improve this system so that people are more accountable and able to actually get on board with what we need, which is data to show.
Yeah. Well, there's
efficacy.
two aspects. It's convincing the client and convincing the provider or clinician. And, you know, the storyline is, oh, it's too hard to wrangle them. They're in detox. They don't want to talk. They don't want to do be inquired about. And I remember going through it with MAPS, and it takes a strategy, and you set people up from the beginning, even before they come to treatment. And you say, you're actually going to be contributing to science, and you can withdraw, and it's anonymous. And you wait, and you make sure that whomever is doing the interviewing, which ICEERS has amazingly beautiful people working with them. And I've been interviewed for over an hour and a half about one experience. And it's tough, but it's doing Ibogaine and then explaining it to someone else is ineffable. It already is that way. And so contributing to science and starting to explain and put into words what goes on for us is something to be encouraged. And that's what we need to do when we work with Ibogaine anyway, right? When you work with your clients, don't you need to encourage them to get out of bed sometimes or just go for a walk, or come on, let's go eat something? I mean, you have to nip at people's heels already, don't you, for your job? Yeah, so it's adding that in, and I suggest, you know, as a provider, clinician, starting from right when you have your first talk, not with ECG, you know, get that ECG, and there's an ICEERS study, you know, if that's, I hear it's still open, you know, you're very welcome to talk to them, and then, or just collect your own data in your own way. There's many software systems. Jonathan has some great ideas. You can talk to Doug Green, and there are numerous people you can speak to about collecting your own data, and we do that as well. In terms of our own style and how we do it. Everybody can do their own style. And then it's sharing. It's the sharing part.
Thank you, Claire.
Thank you. We have another question. You might recognize the voice.
Is that Professor Dr. Jeremy?
Claire, the question is... question is, do you know how much love there is in the audience to you here?
I feel it.
We love you very
I have
much.
goosebumps. I have chicken and rooster bumps.
We all love you very much, and we miss you.
I
We're sorry
love all
you're
of
not
you
here.
too. I'm glad to finally be there. For 2 nights in a row, I've been up all night waiting for my spot.
You did great. You did great. Just a couple of lines. You know, I mean, I'm sharing many of the thoughts that you expressed here. I mean, this is a chaotic movement. And I think humanity is chaotic. And where we try to put things in order, especially things that has to do with spirituality and personal growth, it's very difficult to put it in a box and move it from one place and repeat it the same way elsewhere. So I don't have any good answers. One idea that came along, and I wanted to ask your opinion, is a patient certification program for clinics. So those who don't have this certification program in place, they would know that it has not been researched by a group of with standards, and has not been ticked as an adequate place in terms of safety and so forth.
Right. Yeah, that idea came up quite a while ago, a long time ago, back in Barcelona, I think. And at the Gita conference there, that was 7 years ago, and I'm sure it's come up even before then. There's an organization that came along called the Ethnobotanical, I don't know, Ben Delonin would know the answer right away, the Ethnobotanical Research Organization or something, and it was attempting to protect and stamp certain ayahuasca providers and indigenous communities that were providing ayahuasca. And he was for lack of a better word at the moment, white guy who'd taken ayahuasca once or twice and then went on to go and try and stamp and certify ayahuasca shamans. It upset a lot of people, and a lot of the whole ayahuasca community felt very like, who are you coming along saying who's who and who's not? And we felt like with Gita, I remember that day we had a big argument about it. That we must only have the best of the best, and it was like, no, we need everybody included. Those who don't know something need information the most, need to be included the most. Those who aren't included that's what I was talking about with the social dislocation. And the certification program is, for me, in regard to Gita or an alliance, perhaps, I don't know if I would want to be a part of that, because I remember in going through Gita, which, if you remember, used to be IFIP, that was the International Federation of Ibogaine Providers, the pre-Gita name. Yeah, it was very Star Trek-y. It was cool. Maybe we need an IFIP. The girl with the Ibogaine molecule on her muscle can. You're in the International Federation president.
Okay, we have another question.
Certified. Boom. I don't know what to say about certifying. Regulation is the answer for that, in my opinion. If you're going to
we need safety regulations.
Regulation. It's like Clear Sky. They go all the way to the top with Kofi priests. My bio is outdated because that's what's going on in Mexico. I worked with Dr. Morales, and he went on to create his own clinic. And I had another doctor who was a client, a patient, a fentanyl patient, who created a clinic of his own in his hospital 6 months later in Mexico. So, how do you stamp these people?
Hi, Claire.
Hi.
I'm sorry, I didn't.
My South African brother.
I'm sorry I didn't respond to your question on Skype last night because we were partying too hard.
That's okay.
It was difficult to get up in the morning too. Yeah. What I wanted to know, what I think was important, a lot of people here might not know about Gita, and you mentioned Gita numerous times in your talk. Mm-hmm. Now, obviously, you know that there's a meeting scheduled for Gita tomorrow morning.
Yes, I asked if I could be transformed in there and somehow get in there.
Okay, that's good. But maybe I think you should motivate the people out here on why it's important for them to attend such a meeting, and what's the intention and aims of this meeting, and what we like to achieve.
Okay. So there are quite a few people in the audience who are not familiar that there's a global Ibogaine Therapy Alliance. Would you like me to explain what it is and how it formed?
Very briefly, because we're finishing now.
Okay. It's an alliance and it's a therapy alliance. It's an Ibogaine, not just alliance of therapists, scientists, researchers, doctors, providers, also of patients, and has existed since it formed out of the conference to honor Howard Lotsoff in Sayulita in 2007. At Boaz started it as the IFIP. And Howard wanted us to unite. And it was when it was a smaller movement and we all knew each other and would call each other and give each other advice or say, oh, yeah, I just had a guy just like that. So GITA formed, the Global Ibogaine Therapy Alliance, and Jonathan Dickinson was executive director, and it went through several phases of several boards. And then in the last year and a half since the last conference, since the executive director resigned, it has fizzled. And it is an alliance that is so essential, and that's why I was talking about this. That's why I brought this up as part of the talk, as the solution to, Patrick calls it Gita 2.0. There's a whole new, fresh movement there. Murtaza, I'm looking right at you. He can bring sanity, and not I'm a junkie, I just took Ibogaine and it rules the world. He can have some sanity there. There's quite a few very sane people there. And these other people who are attendees, who are learning about Ibogaine and interested in practicing with it, are brand new. It's a whole brand new, fresh set of interests. And so what I suggest, if you wish to learn about Ibogaine, if you join the Gita meeting, you're going to be with people who, like Bruno Rasmussen and people like me and Patrick, and anybody who comes to that meeting are people who care about spending their own time and their own money trying to unify this movement and share information and bring people together and encourage research and sustainability.
Okay.
So,
Claire, thank you so much. Sorry to cut in.
No, I don't feel cut off.
That was brilliant. So can we have a round of applause for Claire, please? Thank you. Thank you so much, Claire.
Thank you so much for having me there. Thank you.
Bye.